And I had an amazing experience this year when I got to meet you in person in San Diego at the Symposium for Metabolic Health. I can't believe it's been basically like 3 months since we were there and home and back to work and all that stuff. And I do feel like I'm still kind of buzzing from that conference. And I really appreciated the fact that I got to see you, got to meet you and chat in person and all that stuff. I've been asking everybody since the conference, so I don't want to make an exception for you. What were some of your standout moments as you're reflecting on that conference this time? What were some of the more special things that you really appreciated?
Oh, it was a great conference. That was actually the first time that I have ever been to a low carb USA conference, believe it or not. I've been to lots of different ones, but not that one. And I was honored to be a speaker there. That was great. Um, I don't know. I like the amount of science that is kind of put together with just practical considerations about doing low carb. And I love that there was so many different um, types of talks about different kinds of conditions. So I think that, as always, I love Georgia's talks, although I've heard many of them repeatedly. But I really liked Drew. Drew is a researcher who is coming out of Volek's lab, and they did a study on depression in college students and the use of a ketogenic diet. Now, the college students didn't have any formal diagnoses of a mental illness or anything, but they were looking at depressive symptoms. And I just thought that was a great talk because Drew was talking about how these college kids did it. They did it, they did a ketogenic diet in college during a time of life where we would just expect, oh, there's no way that those kids that age, or those adults that age could do that, right? And they did it in spite of dining halls, and they got it done, and we know that they were compliant because they made ketones, right? So, so yeah, I thought that was my favorite talk, I think.
I love that. That's fantastic. I don't know if I told you this, but my plane broke on the way from Salt Lake City to San Diego. So we had a big delay, and they offered passengers like $700 vouchers if they would have taken a delayed flight. And I did not accept because I knew I would have to miss Georgia and Drew's presentation, but I believe you were number three and I really didn't want to miss yours. So I gave
Oh,
up a $700 voucher to be there for your talk. I don't know if
oh
I
my
told you that.
goodness. Oh my goodness. That's
Um,
wonderful. Yeah.
yeah, so
Thank you.
excited to hear you and your presentation. You did a wonderful job. It's really interesting to me. Like you had already introduced me to Lauren Kennedy West, who we've interviewed on the show. Thanks to you, she's really had a great time kind of stepping back from medications with her schizoaffective disorder. And what an inspiring story. But I go to these conferences and I think that all of you who work in this space are all working together all the time, or I've heard of everybody in this space. And you get this sense of like Dr. Lori Calabresi, I believe is how you say her name. I didn't know who she was. She's got
She's
this whole
amazing.
program that she's running
Yeah.
on her own, like going on walks and doing book clubs. And she made a wonderful presentation. Guido Frank, I have never heard of this guy, and he presents amazing information about anorexia. And we just hear from people who work in your space how important it is to get together because, again, it's a lot more siloed than I think somebody would assume. It's not like you guys are always getting together and talking about this stuff all the time.
Yeah. No, so I have to say, and I don't know what it's like in other kind of low carb, kind of ketogenic professional communities and spaces. I've only had the privilege to kind of branch out and work with the metabolic psychiatry kind of peeps, as I call them. But they are amazing, and we're constantly collaborating. We're constantly kind of, making up projects together to move the science forward and to move clinical practice forward. And I'm sure it's like this in other communities that are focused on particular diagnoses or areas of illness, but we're just all so really focused on getting this pushed through as a treatment option for people. Like, we are literally bananas excited every single time we come together, and we're just, because we're seeing people get better, that we've got just brilliant. So I just want your listeners to know, if any of them are um suffering with mental illness or have a family member that is suffering from mental illness, I want you to understand that these people in this space are wildly driven and passionate and are constantly working tirelessly for you to make sure that this becomes a more accessible treatment, and not just like accessible at all costs. Like they are really doing just the highest level research studies and science and putting it together, and how do we get better clinical outcomes, and how do we do this RCT so it is unassailable, right? You know, the outcomes, and how do we support these people coming out of trials, and how do we put treatment teams together? Like they are all over it like you wouldn't believe, and it's just nonstop in this
Yeah.
space. Like can't stop, won't stop. Isn't that like a hashtag or something? Like that's what it's like. So I'm just really proud and excited, and there's every reason for everyone listening to this to have lots of hope about what's coming down the pipeline for everyone.
Absolutely love that. I'm thinking back on the first time we chatted about this, and I've always just loved your passion. I've always on this podcast tried to wind you up about something and get you talking super passionately, either about ketones or the work you do, because it's so infectious and I love it. But thinking back on the first conversation, we could have said those exact same things and like, yeah, we're working on the studies, we're trying to get the RCTs, and thinking of the practicality of some of that stuff, even just a few years ago, was kind of a challenge. And there really wasn't a lot of like funding in this kind
Mhm.
of thing. And like thinking how any of that stuff would have gone down would have been kind of tough. And in that time, we see the rise of the Bazuki family and their son Matt, and they create a foundation. There's this all of a sudden infusion of money directed towards this. You never know when you start something. You start a work and you just put your head down and you keep going. What things will manifest themselves to you and open up new possibilities that I would have never foreseen a few years ago.
Yeah, we're so grateful. I mean, it's not just the bazookies that are funding these studies, although I'm sure that is the primary piece. Like for example, Deanna Kelly had that Maryland study that was partially government funded, I believe. And so we're seeing, I mean, it got canceled, but that wasn't because of the funding. It was because of the Maryland public health person. And don't get me going on that.
Yeah.
Um, but uh, but yeah, so I think that there are multiple funding opportunities that are starting to kind of show up. And every time I see a talk given at a more conservative type of conference, the researchers, like for example, ISBD, the International Society for Bipolar Disorder. I went this year in Iceland, and I went the year before. And when Georgia Eid and Ian Campbell and Shivani Sethi gave some of their talks, you could see the researchers coming up just really interested.
Great.
All these people, they really do want to see recovery. They really do want to see better patient outcomes. They really are tired of watching people suffer,
Yeah.
and so when that kind of data drops, they really are interested. So yeah, who knew that this space was just kind of going to blow up so quickly? Like I kind of feel like I knew, and maybe I said this out loud. Hopefully I did. I want credit, right? Because it's like people are going to see other people recover, and people are going to see other people get well, and they're going to want a piece of that. They're not going to be able to put this, back in the box. This is going to be a momentum building event for people. So yeah, so
Wonderful.
thank goodness for the bazookies though, because the support with that. And then also uh I don't, there's some different foundations that are kind of starting to kind of pop up. So oh, and I think I can say this. So Keto Mojo, for example, announced several years ago, actually, on a interview with Doug Reynolds, I believe, a low carb podcast, that they were creating a foundation to kind of help, and what they were going to do with that. I don't think it was clear back then, but that's starting to take shape. And so that might actually also be an additional support for different types of activities within this space and others for
That's
ketogenic
amazing.
diets. Yeah.
Wow. Yeah, that's so amazing. It's so cool to consider the potential for the future. You mentioned this is your very first, Low Carb USA event. You mentioned Doug Reynolds. What a wonderful job he does at the microphone to keep people from asking dialogues for their
He's tough.
questions.
Yeah.
He is very tough, and it's so cool to see. The people that show up to ask the questions. Like again, Dr. Lori Calabresi asked several questions. Dave Feldman is asking genuine and honest questions. Dr. Tony Hampton, Dr. Brian Lenskis, like all these guys are asking questions, but it's intermixed with lay people. Were you pretty impressed with some of the questions and the knowledge base that you heard from people that are not necessarily experts in the field? They haven't studied this. They're just kind of lay people. And did you also get a lot of value of not just mingling with people that are doing the practice like you are, but also mingling with the day-to-day kind of people who made their way to the conference to learn more?
Yeah, that's what I noticed about this conference that was a little bit different than the usual conferences that I go to, was that there was really a large public component to this conference. It wasn't just a bunch of doctors and therapists and psychologists and psychiatrists hanging out. It wasn't like there for only medical education or CEUs types of thing. It was really a great mix of that. And it was cool because I would see like people in the publics, having real conversations with doctors and other really well-educated individuals in the ketogenic space. And so I think it's a kind of a special conference that way. And I would say the lay public at Low Carb USA is quite advanced in terms of understanding metabolic health and the effects that has on different conditions.